There's no shortage of facial lasers on the market. They claim to firm, tighten, even erase skin damage. Well, now there's a new device that claims to do all these things with zero pain or downtime, so we had to put it to the test.
Hi, Brenda.
Hi, Dr. Batra.
So I know we've talked over options for the acne scarring, and you've done an amazing job getting the acne under really good control. But many of the devices that were on the market really carried a significant risk of hyperpigmentation, so we've been really hesitant to try them. We're going to put to the test this new device, the Viva, which is a fractional radiofrequency device. So that's why I'm excited about this device, because if it performs as it should, it really is colorblind and safe in all skin types. And I just want to gauge how your skin reacts. Looks like you're getting nice and pink from it. So what I'm doing differently for her, I'm really trying to improve the little divots and also delivering more heat, more rigorous treatment. Perfect. Okay, so we're done.
Oh, awesome.
I hope we see some results really soon.
Board-certified dermatologist, our good friend Dr. Sonia Batra joins us along with her patient Brenda. And you know, why was this a good option for her?
So for Brenda, she has olive-toned or pigmented skin, and as I mentioned, you know, the resurfacing options that are available for true scarring are fairly limited. Most of them do carry a significant risk of hyperpigmentation or even pigment loss. So most patients you'll either have to pre-treat with a fading cream and still take a chance, or just the technology isn't safe.
So it's almost like you're trading one problem for another. You might treat the surface issue, but then you wind up with lighter or darker discoloration.
Looking at these pictures clearly, in somebody like this, would you typically also want to do some fillers and other modalities?
Absolutely, yeah. So I think, you know, with any complex case, you're always trying to tailor the technology and the treatment options. But in this case, we didn't do anything else. We really just strictly wanted to see if this device in this context delivered any results.
And what it's going to do below the skin is actually promote your own skin to produce collagen, elastin, all those things, and break up the scar tissue with the needles and fill.
What do you think, Brenda? What was your experience like?
It was pretty exciting. For one thing, it was the first time I was trying something that was, you know, actually like meant for my skin. And the process was pain-free, felt pretty cool. It was just like this little thing punching into your skin, a little warmth. And no downtime. I went back to work the next day. And then about like 5 days later, I felt like a little fresher. And when we looked at the pictures, I was like, okay, so it's actually will make a difference if, I mean, I've got like 20 years of scarring, so this is not like an overnight, you know, miracle that's going to happen. But hopefully, if I keep at it, you know, I should see, you know, good results, improvement at least.
Good for you.
Well,
Feel a little better
you seem
about
very
myself.
satisfied. I want to introduce Pamela, who also joins us. Now, same procedure, but Dr. Batra, this was for a different skin issue?
Yeah, so we really just wanted to put the device to the test and see if in different contexts it worked. Pamela, totally different. She has long-standing sun damage, has had some skin cancers in the past. We really wanted to work on her texture, work on pore size, sort of tightening. And so we used it in a kind of different settings. We tailored it a little bit more to her and then wanted to see what kind of results we would get as well.
Pamela, well, we bring up some pictures. What did you think of the results?
Are you happy?
I loved it, and I think the process was really very pain-free, and the recovery was super quick, and I think within a couple days, makeup hid anything that was going on, and 5 days later, I loved the way my skin felt.
Great.
And last but not least, before we head to break, what does something like this cost?
So generally, I should clarify that this is usually done as a series. Okay. So especially someone like Brenda, who has more pronounced acne scars, this was just the first of what I would envision to be 3 or 4 treatments to see a pretty significant result. But generally, you're going to see it cost about $500 to $1,000 per treatment, depending on where you're getting it done, who's actually doing the treatment.
Well, Dr. Batra, thank you for helping us out, ladies. You look fabulous. More to come.